Hello everybody, and welcome to another edition of Eyecare Today. Again, we're the place where you can get all the latest and greatest information on anything new in eye care. If it's new in eye care, you're going to see it here. If there's any questions, 453-2020 in our Hazleton office, 421-3342 in our Stroudsburg office, www.drkislan.com. And when we talk about what's new in eye care, on our previous show, again, remember I said this is a two-part show, this is part two. On our previous show, we were talking about Lipiflow. Lipiflow is the newest available treatment out there for dry eye. It is groundbreaking technology. It's been in the works for over 10 years, and we are extremely proud to be only the fifth practice in Pennsylvania to be able to offer this treatment to their patients. Allentown, Philadelphia, and Lower Harrisburg are the only areas in Pennsylvania that have it. So Northeast Pennsylvania has been neglected, and we're proud to now be able to offer this treatment to our patients. Well, what is Lipiflow? Who should get Lipiflow? Well, dry eye disease affects anywhere from 35 to 50 million Americans a year. And in our last show, we talked about the pathophysiology, and we showed a video of what exactly happens. But to just sum that up real quick, we have little tiny oil glands in the margins of our eyelids that secrete part of our tear film, the oil part of our tear film. And the oil part is extremely important. Think of an oil slick on water. And if you don't have a good oil layer laying on top of the water just evaporates away real quickly. And that's what happens in dry eye disease. The water evaporates quickly, our eyes get dry, red, scratchy, irritated, our vision fluctuates. And believe it or not, the eyes can actually overwater. So it can be a very, very detrimental condition for a lot of patients. A lot of patients suffer from it. And Lipiflow is the newest treatment that we can actually provide to our patients. So what we talked about a little bit in the last show, and I just want to recap here, if you think you're suffering from dry eye disease or frustrated with any treatments you've had in the past, you need to give our office a call and come in for a consultation. We are the only practice in the area offering this latest technology and this latest treatment. What we do in evaluation is we go over your medical history. We do a lot of tests to really determine the type of dry eye that you have and the extent of where your dry eye is. And we actually do some specific tests that no one in the area can actually do because of this technology. One thing we do is there's a special instrument called the meibomian gland evaluator, which we'll show you a close-up here. But this instrument allows me to gently press on your glands in your lids and actually try to secrete the oil. It exerts a specific pressure on those glands, and believe it or not, there's about $25 to $30 million in research and development just into this piece of equipment that was mandated by the FDA. So we can evaluate patients with that. We also have a special piece of equipment called an interferometer, which is actually what I'm sitting next to right here. Patients come in, they look into this machine, and there's actually a video that we actually can get from the patient, and what it shows us is the specific oil part of their tear film and how much oil there actually is laying on top of their tears. And the reason that's important is because that tear film is what is really detrimental to the patients in this condition. So we have these tools here that we can evaluate a patient and really show what's going on. And if they're a candidate for Lipiflow, we discuss that. If they're not a good candidate for Lipiflow, there are other treatments. One might be omega-3s, such as fish oil, which we recommend the PRN brand. The dry eye omega benefit is one of the best omega-3s out there. The way I explain it to patients, though, if you're getting an oil change in your car, you get rid of all the bad oil. You don't want to put all the bad oil back in. You actually want the good oil back in there. So if we're going to do this treatment and we're going to basically do an oil change, make the filters better and everything, which is what we're doing to the meibomian glands, we want good oils in there. So the omega-3s and Lipiflow together seem to be this match just made in heaven. So we have all the tools now to properly diagnose patients and give them the best treatment that's out there. And again, we're proud to be the fifth practice in Pennsylvania that can offer this treatment. Now, for those of you who don't know, I have myself severe dry eye. I've suffered for about 10, 12 years with severe dry eye. I had LASIK about 12 years ago, and my eyes have been extremely dry since. Personally, I use Restasis twice a day. I take omega-3s on a regular basis, the PRN brand. I've had punctal plugs put in my tear ducts. And of course, with electronic medical records, I'm on the computer all day, so I really do suffer. So I would be the perfect candidate, you would think, for Lipiflow, and that is the case. So what we're going to do is we're going to take a quick break, and when we come back, you are actually going to see yours truly have the Lipiflow procedure performed. You'll see how painless it is, how simple it is, and really how much relief it can provide. So we're going to take a quick break, and when we come back, you're going to see me having the Lipiflow procedure performed. So we'll be right back. Welcome back, folks, and you've heard me talk about Lipiflow a lot. This is the new treatment, FDA approved for dry eye disease, specifically the evaporative form of dry eye disease. Groundbreaking treatment. It's a 12-minute in-office painless treatment that we do for patients with evaporative dry eye. And again, if there's ever any questions or you want to get in contact with us, our phone number is in the Hazleton office, 453-2020. That's Hazleton Eye Specialists, and in Stroudsburg, 421-3342. Stroudsburg Eye Specialist. You can visit our website, www.drkislan.com. And if you want any information on Lipiflow, it's www.lipiflow.com. And you can also go to YouTube and actually type in Lipiflow. You can actually see some of the treatments being done. But better than that, what better than a live treatment? And in this segment, I'm joined by my colleague, Dr. Alexandra Wozmansky, and one of our nurses in the office, Nicole. And it's time to, if I'm going to talk the talk, it's time to walk the walk. And for those of you who don't know, I have pretty moderate to severe dry eye. I had LASIK about 16, 17 years ago, which contributes a little bit to my dryness, but I presently take Restasis twice a day. I use omega-3s, about 6 to 8 capsules a day of the PRN omega-3. Dr. Wozmansky has put punctal plugs in my tear ducts to help with the dryness. So today, to help, we're going to perform the Lipiflow treatment. And again, it's painless, and besides Sam LaSlante Sr., I am probably one of the biggest babies out there. So if I can do this, I think anyone can do this. So I'm going to turn over to Dr. Wozmansky. I'm going to be quiet now and be a good patient and have her take it from here.
All right, you ready?
I am ready.
Okay.
Be gentle.
Yes, somewhat. All right, first thing you're going to do is just relax back. And Nicole's going to put some numbing drops in, which is going to last throughout the whole procedure for you. Let me get you a tissue. There you go. Good. And that's just going to make them more comfortable as we go through this. Now we're going to insert the left applicator first. And Nicole's going to help me hold it in position while we get everything set up. And it's simply going to go in between the eyelids. If you can just look down for me, I'm going to slide it up underneath the top lid first. Good. And now look way up high. And we're just going to bring that lower lid around, make sure everything's in position. And Nicole, if you can just hold that a moment.
And that doesn't hurt at all, folks. You know, like Dr. Wozmansky said, she numbed my eye. Doesn't hurt at all.
And we're just going to tape it to the chair so it holds position properly. Good. And now I'm going to put in the right applicator in the same way. Okay. Again, if you'll just look down, we'll slide that up underneath the top lid. Good. And look up nice and high. Get that lower lid around. Great. And Nicole, if you can hang on there. How you doing there?
I'm doing great.
I thought you would be. All right, one more piece of tape, and this is just going to keep both of them lined up together.
You're not taping my mouth, are you?
Not yet. And this is going to go right across the center, touching the nose. All right, Nicole, you can let go. Let's see how that feels. You doing okay?
Yep. Of course, everything's dark because the applicators are covering the eye, protecting the cornea. But yeah, everything feels fine.
Okay, so his part's done. He just needs to relax, and we're going to start the instrument. Now, it will make some light noises as we go on. There's 3 different cycles it goes through. The first 2 minutes is just a warming cycle, and that's going to bring you up to a set temperature, and you should be feeling that start to warm up right about now.
It's getting a little bit warm. So just so we can tell the folks, one of the things Lipiflow does, it heats the oils in the eyelids to 108.5 degrees Fahrenheit, which is just 10 degrees above body temperature, and that helps loosen the oils. And then those noises are the pulsations, right, Dr. Wozmansky?
That's correct.
So what's happening is we have these pulsations that are actually squeezing the lids and actually getting rid of all the oils, the bad oils in the eyelids, and that's going to cause the glands to reset and start secreting better oils. And do you tell your patients to continue their omega-3s?
I do. Once you clean out the oil glands, you want to make sure that it keeps producing the proper type and everything's nice and thin and doesn't get clogged up. So it's important to do preventative maintenance.
And just what the pulsations feel like, it kind of feels like if your eyelid's twitching. That's a little bit of what it feels like. There's absolutely no pain. In fact, it's kind of like an eye spa.
There you go. So the first 2 minutes is just a warming cycle, and we've hit our maximum temperature. Then you go through a 2-minute cycle of a light massage, followed by another 2-minute cycle of a deeper massage, and then it goes back to phase 1 again. And that goes on for 12 minutes total.
Do I get a facial with this?
Not today. If Nicole wants to do a little extra work, sure.
And there's absolutely no discomfort. In fact, it feels very soothing. It feels like if you have a warm washcloth on your eyes and just kind of letting it sit there. And again, the pulsations just feel like kind of like little eyelid twitches. So there's absolutely no pain. So this goes on. What time are we at here right now?
Coming up on 10 minutes. So you almost finished the first 2 minutes.
So we're 2 minutes in. So folks, what we're going to do is we're going to take a little break here, and I'm going to finish the bulk of my treatment. We're going to come back when I have about a minute or 2 left, and then we'll show you how the applicators are removed, and we'll go from there. All right, welcome back, folks, to another segment of Eyecare Today. As you can see, we are in the end stage of my Lipiflow procedure. If there's any questions, comments, contact our offices in Hazleton, 453-2020, Stroudsburg, 421-3342, www.drkislan.com. And how much time do we have left, Dr. Wozmansky, on my treatment?
Almost 40 seconds.
So the last, in this part of the treatment, in the last cycle, there is still the continued heat and pulsations, which are getting rid of all the bad oils in my oil glands, which is going to help these glands reset to work better. So again, I've survived the 12-minute treatment. I'm still here, and it's very comfortable, relaxing, kind of just some warmth on the eyes, and no pain at all. So this is the goal of this treatment is to help patients with their dry eye disease, and this what we think is going to be the next biggest treatment for dry eyes. So we're really pretty excited. I think we're just about finishing up.
Left one is done, right one is finishing just about now. Let's give it another minute to set.
Now, taking the applicators out is just as easy as putting them in.
Okay, it's ready. So we're just going to remove the tape here, and I'm going to have you look all the way up. Good. And Nicole, if you can just hold that. I'll be careful with you.
Leave some hair, please.
And looking up. Get that down. Good. Go ahead and sit up and show everyone.
Everything's good. So we expect after about 6 to 7 weeks for the treatment to kind of kick in, where patients start noticing an improvement. So we'll usually see the patients back at about the 6 to 8 week point, go over any more drops that we're going to use, or any other recommendations we have. And again, there's no pain, there's no discomfort. So if anyone has any questions or would like to come in for consultation, you can give our offices a call. Again, Hazleton, 453-2020. Ask for either myself, Dr. Wozmansky, in Stroudsburg, 421-3342. Again, you can ask for myself, Dr. Wozmansky, or Dr. Olzinski in our Stroudsburg office. Check out our website, drkislan.com or lipiflow.com. And again, we're very proud to have this treatment in the Northeast Pennsylvania area. We're only the 5th in Pennsylvania, first ones in Northeast PA, so really exciting technology that we think is going to help a lot of people. So we're going to take another quick break, and we'll see you on the next segment of Eyecare Today. Thank you. All right, welcome back, folks. Again, you're watching Eyecare Today. I'm your host, Dr. Thomas Kislan, and that was yours truly having his treatment done. Remember, if there's any questions about that or anything else that we've talked about, 453-2020 is our Hazleton location, our Stroudsburg office, 421-3342, www.drkislan.com. You can always look us up online. So as you could see, that was a short, painless treatment. Right now, when we're taping this, I'm about 4 weeks out from when we actually filmed and taped that treatment. And my eyes are already starting to feel better. But what's it like more like a couple months after treatment, and how are your eyes doing? Well, we're actually going to talk to a live, living and breathing patient. A lot of you may know her already. Joanne actually works in our office, and I have known Joanne a lot of years, right? A lot of years.
Definitely
In fact, when I first got out of school, I actually worked at an office where Joanne worked, and that's where we first met. So I've known Joanne a lot of years. So she's not only a person that we see every day here, but she has suffered from dry eye, and she's going to tell you a little bit of her story here in a minute. But Joanne was actually the first patient that we treated in the office. So she was kind enough to be our guinea pig. And she's still sitting here breathing and enjoying life. So she obviously survived the treatment. So Joanne, thanks for sharing your experience and your, I guess your treatment and your struggles with this condition over the years. Let's go back 15 years when we first met, and tell the folks out there watching at home really what your condition was and what your eyes were feeling and what it's like.
Well, at that point, I think I was still wearing contacts, and that was when, with the dry eye, you get that irritation and you want to use drops continuously. Got to the point where that was so annoying that I stopped wearing contacts and just started sticking with the glasses all the time. And it was annoying because every few weeks it would be, I'd have that feeling of that sandy, gritty feeling, something in my eye. I'd be coming to you and say, please look at my eyes and, fix it. And just, it got to the point where it was enough.
And what were some of the treatments back then that we tried? I know obviously artificial tears, you did a lot.
Artificial tears really was the only thing we did at that point. And we did
try, if I remember, we tried plugs, which didn't do really much.
No, they didn't. No, that didn't work.
Do much at all. And what happens, folks, with this type of condition, we talked about the difference between something called aqueous deficient, lipid deficient dry eye. We find sometimes that plugs may not be the answer, and that's kind of what happened with Joanne. And back then, there really wasn't much. We didn't know Restasis wasn't out.
No.
We didn't know really much at all about omega-3s. In fact, I don't think doxycycline even we did.
No, we never tried.
Point.
We hadn't tried that.
Doxycycline is actually an antibiotic that is usually used for patients with rosacea and some other conditions, but we use it in eye care because one of its secondary effects is it can sometimes help with this eyelid condition, but there are some side effects with it. So it's not one thing we go to all the time. But fast forward now, let's say 3-4 years ago now, and now you've been here how long now?
Almost 6 years.
6 years. So you've put up with me for 6 years. And in that time that you've been here, what have we done with the eyes? Because now we knew about omega-3s, we knew about Restasis. So tell the folks at home kind of what we've been trying to do, and did it help?
Well, we started first not just with the artificial tears, but the omegas. That made a difference and, eased it up somewhat.
But didn't relieve it?
Didn't relieve it. Eased a little. Started with the Restasis. Started noticing somewhat of a difference, but still it wasn't enough of a relief that it was still annoying that I was,
Still affected your life.
yeah,
Would you say that this condition has affected your life?
yes.
Yeah. So we hear that a lot, folks. I mean, Joanne's on the computer all day. She's working with patients. I mean, really, the eyes get dry and irritated. So, and again, we see all these things we've tried with Joanne. Again, like I explained, and you saw in the video we showed with the meibomian glands, if you don't get those glands actually working better and secreting better oils, we can do, and secreting enough oils, we can do as much as we want on the surface of the eye, but if we don't get into these glands and actually make these glands work better, patients just not going to get better, and they're going to suffer for years and years from this. And I remember that you go through days where your eyes were red and you would come in and all bloodshot. And I know you don't drink, but it looks like you were out,
you're
on
right.
a bender the night before.
Yeah, it did. There were some days that were really bad.
Yeah, so, fast forward now to a couple months ago when I said, Joanne, we're getting this technology. I want you to be the guinea pig. What did you think?
I was like, yay.
Were you
Hopefully.
scared?
A little nervous, but not scared. It's,
So
nothing to
we
be
decided
concerned.
we decided to do the treatment, and so tell the folks exactly what it was like.
Well, when your eyes are numbed up first, it's put into the eye. There's no discomfort at all. No problem afterwards, no pain or anything.
What did it feel like when you were having it done while the treatment was being
It's like a massaging, a warm massaging feeling.
A lot of patients say it feels like an eye spa. That's what a lot of patients say.
Yeah, because it is soothing, and it's that heat made a difference.
And the 12 minutes probably went pretty quick.
Oh, definitely.
Right.
Yeah, that was very quick.
And I think you saw when my treatment was done, folks. I mean, the treatment went really quick. I mean, I wasn't in any pain, very quick and comfortable. So tell me now, we've been how long since the treatment?
February?
So it's February. So, we're about 4 months out. How do your eyes feel now?
Great. The past couple weeks, they felt awesome. I mean, the best they've felt in years.
And, the one thing here is you're still doing your Restasis, you're
Yes.
still doing your omega-3s. That's
Right.
one thing we have to tell patients is we don't cut out a lot of medicines cold turkey, because we found that continuing the treatments still enhances the treatment, gives patients a good result. I mean, just looking at you now, your eyes aren't red. They're not, like you said, you haven't been complaining. They're not as irritated. Do you find yourself reaching for the tears as much?
No, that's the best part. Is before it was using it 3 to 4 times a day at least, longer if I was at the computer more. But I haven't used the rewetting drops, the additional rewetting drops at all.
So you feel like you're thinking less about your eyes. You get through the
definitely.
day and you're just not thinking.
Definitely.
And that's what I hear from a lot of patients, folks, is, they really, they don't think about their condition as much. They go through 6-7 hours a day and they're like, geez, I haven't put drops in today. So I think probably Lipiflow has been a good thing for you,
Oh,
right?
definitely. Been a lifesaver for it.
So, and that's what I hear from patient folks. So the key is here, I mean, this show went really quick. We may do another show on Lipiflow. I know there's going to be a lot of questions, but if there's ever any questions, feel free to contact us, 421-3342 in Stroudsburg, 453-2020 in Hazleton. Remember, if you have dry eye disease, if you're suffering, if you know anyone that suffers, you have to give us a call. Again, we are proud to be the 5th practice in Pennsylvania to offer this treatment. Call for a consultation. One of our great staff, including Joanne, will talk to you. We'll do a complete workup, see if you're a candidate for this treatment, and if you are, 12 minutes could absolutely change your life. It has changed Joanne's. It has changed other patients' lives that we've treated. So again, thanks for your time, folks. Thanks for allowing us into your living rooms and sharing some time. Have a great summer. We'll see you next time on Eyecare Today. I'm your host, Dr. Thomas Kislan. Have a great one.